Today's topic is on an introduction to endodontics. By definition, endodontics is the branch of dentistry concerned with the morphology, physiology, and pathology of the human dental pulp and periradicular tissues. As far as the scope of endodontics is concerned, its study and practice encompasses the biology of the normal pulp, etiology, diagnosis, prevention, and treatment of diseases and injuries of the pulp and associated periradicular tissues. Principles of endodontic therapy. Endodontic therapy consists of diagnosis, patient education, local anesthesia, isolation, rubber dam isolation, access cavity preparation, working length determination, instrumentation, obturation, and final restoration. In order to render proper treatment, a complete diagnosis must be done. A complete endodontic diagnosis must include both a pulpal and periapical diagnosis for each tooth evaluated. According to Engel, diagnosis is also the procedure of accepting a patient, recognizing that he has a problem, determining the cause of the problem, and developing a treatment plan that will solve or alleviate the problem. Diagnosis consists of chief complaint, history of presenting illness, objective examination, subjective examination, and radiographs. Patient education. Patients should be informed of their present condition and all the available treatments. Instruction should be given to the patients to improve the oral hygiene, brushing habits, etc. Local anesthesia is administered via injections to numb the tooth to be treated and the surrounding tissues. If the pulp in a tooth is acutely inflamed and therefore very painful, it may take a while to get numb, but your dentist will not start the treatment until it is. In some cases, supplemental anesthesia may be required for certain cases known as the hot tooth. Dental rubber dam is used to isolate the infected tooth from the rest of the mouth to facilitate root canal treatment. Isolation is very important not only for maintaining a sterile field, but also to prevent aspiration of irrigation materials and instruments. The first step is creating the access cavity. This is done to gain access to the infected pulp and create a way to remove the infected pulp tissue. Working length determination. The distance from a coronal reference point to the point at which the canal preparation and obturation terminate. It is measuring the length of the tooth. To measure the canal length so that the correct length of the canal files can be used to prepare and widen the root canal. Instrumentation. Instrumentation can be done by either hand instruments or rotary instruments. It is after determining the correct length of the canal files to be used, the shaping of the canal is carried out to widen the canal so that the infected pulp tissue can be removed, and also irrigating solutions can be injected into the canal. Obturation. It is a method used to fill and seal a cleaned and shaped root canal using a root canal sealer and core filling material. Sealers are frequently used as the sole obturating material in teeth cannot stay on its own. There are multiple techniques for obturation. There is hot and cold compaction, vertical and lateral compaction, single cone and multiple cone. Final restoration. There are many ways by which the final restoration for an endodontically treated tooth can be done. Ideally, the final restoration should provide strength to the remaining tooth structure. It should promote physiologic function of the tooth and surrounding tissues. Indications for a root canal therapy. Caries teeth, teeth with irreversible pulpitis, necrotic pulp, treatable periodontal conditions with endoperiolesions, lesions, supraerupted teeth, fractured teeth, or intentional RC in case of FPDs or overdentures. Contraindications. When there is insufficient bone structure or insufficient periodontal support, RC or root canal therapy is contraindicated. Canal instrumentation is not practical in cases of calcification of the canals or sharp dilacerations or curvature of the roots. In cases of non-restorable teeth, RCT is completely contraindicated. In case of vertical or horizontal root fractures, inadequate crown-to-root ratio, they are a contradiction. The general medical condition of a patient is never an absolute contradiction to endodontic therapy. However, the management of other medical conditions such as diabetes, hypertension, and other medical conditions may take precedence over the endodontic therapy. Before starting the root canal treatment, certain questions must be asked. Is the tooth needed or important? Does it have an opposing tooth? Could it someday serve as an abutment for prosthesis? Is the tooth salvageable, or is it so badly destroyed that it has to be extracted? In relation to the patient's general dentition, these questions must be answered by the treating personnel. If the tooth that is in question serving aesthetically, or would it be better if the patient had it extracted and looked for another cosmetic option? If the tooth in concern is severely involved periodontally, that it is a complete waste to do the root canal for that particular tooth. Nowadays, we have various instruments that help us in endodontic therapy. We have CBCT machines, apex locators, endodontic microscopes, rotary instruments. Enhanced magnification using either a microscope or loupes helps in performing challenging endodontic procedures. Hopefully, in the future, these tools will become more affordable so that practitioners performing dental procedures under a microscope or with a good set of loupes and external light sources encouraged. Thank you.